Moving on then to Public Forum, Mr. Triplett.
Yes. Pete Pearson. Pete, if you'll state your name and county residence, you'll have 3 minutes.
Thank you. Pete Pearson, Knox County. Good evening. I appreciate the discussion that's already been had, but just wanted to add to that. I serve as the Chief Executive Officer of Knoxville Orthopedic Clinic. I'm also a longtime resident of the county and the father of 2 sons who graduated from West High School, both of whom were scholar athletes. So I come to you tonight not just as a healthcare leader, but as a parent who deeply values the role athletics plays in our students' lives. For more than 30 years, KOC has proudly partnered with Knox County Schools to provide sports medicine coverage to every public high school in the system. We currently invest more than $800,000 annually to support certified athletic trainers at 13 schools and to ensure student athletes have access to timely orthopedic care. From August through December of last year alone, our providers treated 479 student athletes who used school-provided BMI insurance for more than 1,800 office visits. Of those, 139 students had no other form of medical insurance. That's roughly 30% of the total. I'm here tonight to express concern about the proposed policy that you discussed and to make accident insurance optional and the transition from BMI to K&K. While the board has not yet formally adopted this policy, it appears to be moving forward operationally. Student athletes are already receiving insurance coverage statement forms asking for private health insurance information, but with no mention of accident insurance options through either K&K or BMI. This is concerning on multiple levels. First, verifying private insurance for every athlete introduces a real administrative burden for athletic departments. Even when a student submits an insurance card, there's no guarantee the policy will be active when a claim is needed, especially in families with changing employment or financial circumstances. Second, the proposed K&K plan introduces more complexity and costs, particularly for football athletes. K&K requires a separate rider for football, and a student could easily enroll in base coverage, submit that information on their form, and unknowingly be left uncovered for football injuries. For families who do try to do the right thing, premiums for football players could jump from $60 to as much as $277 under this model. That would potentially create financial hardships for student athletes, parents, especially when coverage used to be simpler and more affordable. We understand the district is trying to address the fact that it spent close to $200,000 last year covering students whose families didn't submit payment for the required BMI policy. But we believe that there are better ways to manage that concern, ways that don't place the burden on families or put students at risk of falling through the cracks. For these reasons, we respectfully request that the district continue to require student accident insurance and return to the BMI policy until a more thorough analysis can be completed. Collecting a $60 fee from each student is far simpler and more consistent than trying to verify and rely on private insurance that may not be there when it's needed most.
Thank you. Dr. Matthew Rapay. Okay, I don't want to wrap. Rapay, sorry about that, but thank you. If you'll state your name, county resident, you'll also have 3 minutes.
Matt Rapay, Knox County. Thank you for the opportunity to address the board this evening, and thank you for the hard work you put in daily to improve the lives of student athletes in Knox County. So my name is Matt Rapay. I'm a sports medicine orthopedic surgeon in my 19th year of practice. I attended public schools in Middle Tennessee where I played multiple sports prior to attending University of Tennessee. I'm also the son of 2 parents who ran a landscape contracting business who at times were unable to carry health insurance for my family when I was growing up. So this issue is important to me, especially. I have 2 sons at West High School that play football and soccer, and proud, just as Pete stated, to state that my practice, Knox Orthopedic Clinic, has a long-standing tradition of taking care of student athletes here in Knox County. Those athletic trainers that we provide to the county provide year-round coverage for our student athletes. Every Friday night, my partners and I stand on the sidelines of the football fields throughout the county. We sponsor the jamboree that we have every year. And with the monies that are collected from that, those monies have gone to pay for the supplemental student insurance policy. As Pete shared, this past year, we had 139 folks that we saw in our office that did not have insurance other than the supplemental policy. For reference, each of the surrounding counties around our region, they actually carry a plan similar to this. Making health insurance optional as opposed to mandatory will lead to many student athletes who have significant difficulty finding care. Now, I can see and treat an athlete and not charge for my services, but should they need surgical services, there's no option for them. Without requiring the low-cost supplemental insurance, we'll have many students who cannot participate in high school athletics. Often sports are the reason why students stay in school. I know times are hard. The funding for programs was very difficult. Frankly, the $800,000 that Pete mentioned, that used to be $450,000. Internally in our practice, this is a hard thing for me to justify to my partners to continue to invest in this, but we do it because it's the right thing to do. A high school athlete not being able to play high school sports because a $60 policy wasn't available to them, frankly, makes me sad. I could give you examples of folks that didn't have two nickels as a family who tore their ACL that with this supplemental policy was able to have surgery. And then I could give you examples of patients whose family made $50,000 a year but had a high deductible plan of $5,000 where they had a supplemental plan and it was $60 and they got their coverage, whether it was the surgery or the physical therapy that they needed. Everyone in this room would agree we all want to provide what's best for our student athletes within the county. In our current format, and as I've practiced for the last 19 years, I've never had to tell a mom or a dad that I couldn't care for them. I urge this body to consider, as you consider not making insurance optional, to make it as it has been for the past 19 years. Thank you.
Thank you. Keith Britt. Keith, you'll state your name and county residence. You'll have 3 minutes.
Hi, Keith Britt, 506 Knowlton Drive. Different issue, but there's the same common thread flowing through all of this. The more complex you make these policies, the worse results you're going to get. That's not only true to school policy, it's true to life. I am the parent of 3 KCS students, and as their parent, my job is to serve as their role model. So yes, at dinner time, I do have to resist taking my phone out of my pocket to check the weather. And yes, when it's late at night and all I want to do is turn my brain off, I do have to choose to pick up a book instead and let my kids see me reading that instead of looking at my phone. What you have as this school system's leadership is the opportunity to create a structure that helps me parent effectively. You have the opportunity to help my kids concentrate on schoolwork. You have the opportunity to help my kids form worthwhile friendships. And you have the opportunity to do that in an unambiguous way that is easy for students and teachers and parents. I really hope you will reconsider and adopt version 2 of this wireless device policy. A lot of us here tonight are here because we read The Anxious Generation, which clearly shows just how devastating phone use can be for young people, particularly those in high school, teenagers, who are comparing their real-world struggles to the pretend realities they see on their phone. Some of us are here because we watched the Netflix series Adolescence, which shows just the horrific kid-on-kid violence that can occur from the use of social media and unaltered or uninterrupted use of phones. So please support version 2 of this policy. To your point, Ms. Templeton, I do think there is some ambiguous language there concerning storage. I would probably remove all references to J191. I don't think anything more than a rest of the day confiscation is necessary here for the kids to learn their lessons. That will be pretty devastating to them. But our kids are in danger, and we've seen this work, this version 2 work, in neighboring school systems in Hamlin County. We've seen it work nationwide, and it can work here. Let's make it easy for our kids. Let's make it easy for our teachers and our principals. Thank you and Godspeed.
Thank you. Margot Kern. If you'll state your name and county residence, you'll have 3 minutes.
Hi, my name is Margot Kern, 936 Wingate Street. I'm a mom of 3 young boys. 2 are in KCS. I run a group in Knoxville called Knox in Real Life. Our goal is to change the culture around smartphones and kids in Knoxville. We provide support for parents who want to delay smartphones and for parents whose kids have smartphones and are trying to help them navigate an often fraught digital world. Many of our members support stricter smartphone policies for KCS. Several have spoken previously at board meetings, and a couple of us are here tonight. More wanted to speak, but it appears everyone in Knoxville is on vacation this week. But we really appreciate the leadership the board is taking on this issue. I've spoken previously about what's at stake when we let smartphones degrade our kids' learning environment. Magnified bullying, exposure to illicit content, combative relationships between teachers and students, and of course, distracted learning. Instead of rehashing this, I want to speak specifically about the proposed policies. We need a simple policy that can be easily executed. As such, I encourage you to adopt proposal number 2, which is essentially an away for the day policy. So kids are allowed to have their phones before school and they're allowed to have it after, but there is protected time for the entire school day. It is simply too difficult for teachers to have to determine whether a student's phone is off or on silent mode, if they're actually checking it or they're not. When we allow checking in between classes, it makes it more difficult for our students and our teachers. When our kids check their phones in between classes, it keeps their heads in the digital space. So they're continuing to think about the next group text. They're still able to take photos, which contributes a lot to bullying and amplifying fights. So a lot of the issues that we're trying to that we're trying to correct will be negated, I think, if we allow our kids to use their phones in between classes. And it will also be difficult for our teachers. One thing I wanted to draw attention to is in the proposal number 3, it does say that phones must be stored out of sight and in the silent mode, which essentially means in your pocket. And I don't think that there's really any difference between that and prohibiting allowing phones in between classes. Essentially, if you have a kid walking around with a phone in their pocket on silent mode, they're allowed to check it in between classes. So that's something I wanted to draw your attention to. Finally, I want to speak to the board as a parent. I know many of you have tweens or teenagers, and you're seeing firsthand the harmful effects of these devices on our kids' well-being. It may seem impossible to go against the current culture, but parents in Knoxville are banding together to change it. And we are rejecting the idea that kids have to choose between having friends and having phones.
Thank you.
Thank you very much.
I'm sorry.
We need your help to change the culture.
Thank you. Krista McBee. She had to go.